Sometimes guys actually feel better when they lower their dose, but as guys, we always think more testosterone, the better.
Host of the Dr. Adam Hotchkiss YouTube channel.
One of the first things that came up was a guy that they put on Halotestin Monotherapy. He had the most beautiful tits I've ever seen. This isn't f***ing Gyno. Poor guy got implants. That's insane. Like, I was a fake natty, to be honest, for years. If I could go back, I wouldn't have wasted my time doing that stupid shit.
Dr. Adam, you were the worst kind of boy.
It can either make you horny, but it can also fuck up your libido too. Why the would you take your 700 testosterone, your natural, hop on TRT and do 700? Like,
what do you think about SARMs?
If we could make a good one, they would be, I would say, just.
Funny thing, Adam and I were just talking about how gear made us really horny back in the day.
Yeah. Makes you fucking out of control.
Back in the day.
I feel like it can either make you horny, but it can also fuck up your libido too. Have you ever experienced that?
I have. I think it's only because my hormones were out of balance or out of whack.
Well, I mean, like, it happens oftentimes even with guys just on TRT, because obviously when we're talking TRT versus steroids, completely different ballparks. But some guys will go on TRT and bump their dose up thinking more is better. And then they find like their libido actually starts crashing because their testosterone is a little bit too high. And I've been like, yeah, a lot of bodybuilders sometimes don't have amazing libidos. You can be so high that it goes down. It's like having too much caffeine or too many stimulants. No, it's sympathetically driven when you have a lot of testosterone. So you can just feel like your libido is going down because your mind is responding to fight or flight, basically. It's not trying to reproduce. It's not horny in that case.
Oh.
So sometimes guys actually feel better when they lower their dose. But as guys, we always think more testosterone, the better.
Let's go.
Yeah, exactly.
Damn. Okay. Do you think there might be any? Would you say that there's any like range of dosages that you feel like that can potentially happen for people? I know the variety. It would be fucking
it's
huge
so tough.
Range, but
there's a huge range because some guys are like, when we're talking TRT, like I've seen guys feel good at like 70. When they go higher than that, they feel not good. But then, a 70, lot of guys, like 7 milligrams a week.
Wow.
A lot of guys probably fall into like 120 to 150 a week for TRT is where they feel really good. Some need a little bit more, like upwards of 200. But it's less is oftentimes better when it comes to TRT. But then when we're talking like gear use, it's kind of completely different. They're night and day. And then you're adding other compounds. And like we were talking about Tren, and I think Tren just has I had an insane libido on Tren. You?
I haven't done Tren yet.
Oh, you've never done Tren? I think you hadn't last time we talked.
Yeah, I still have it. I've been holding off because I'm a little scared. Yeah. Because I don't know, just all the side effects are exactly what I don't want to experience. Anything that's mental for me is just nothing that I want to experience. Oh, or that affects sleep. Yeah. My sleep and my mental are my two priorities. Well, normally
that's cool to hear because I mean everybody listening should hear this part because Niall looks better than I ever did ever, and I did a lot of Tren and never looked like Niall. So you can look like that without Tren. But yeah, bro. I was scared as shit my first time too. Like I probably did gear for like 3 years before I tried Tren. And then I was like, I have shitty arms. I think I'm gonna start working out arms and do Tren. And I was gonna inject in my bicep for the first time and like hit a nerve. You ever injected your biceps?
No.
Oh, they're awful. I was like, maybe I'll get some side enhancement. And I was already super scared because I'm like, this is Tren, but if I'm doing it, I'm gonna hopefully get some side enhancement. And I hit like a nerve and it like needle shot out across the room.
Oh
and,
shit!
Like not really, but it like. Have you ever hit a nerve?
I'm
like injecting and then it like seizes and your muscle like shoots out the needle.
It's never shot out the needle before.
It's like, like the whole muscle like contracts.
I felt it where it like contracts and it like pushes it out. Yeah. My dumb ass continues to just keep going.
Yeah, I usually redirect at that time and then it burns like a motherfucker.
Yeah.
Yeah. But yeah, Tren, I was super scared to do it too. And it was awful. Like I didn't really get that much out of it, to be honest. It just felt like shit all the time, but I continued to run it for a long time. But that's where like the libido got out of hand. Like we were talking about earlier, on the back of the Huberman fiasco. I was like, oh yeah, I've been there. 6 girls. That's like a standard Tren dose for a cycle for me. Like as soon as I started doing Tren, I would just be like, suddenly like, oh, I'm at one girl's house and I'm telling her I love her and she's my girlfriend. And the next girl, I'm telling the same thing. And I'm like a fucking mess. I can't even imagine doing that shit now. But, and then the time I'm like, oh, everything's normal. This gear isn't changing who I am. Looking back, I'm like, what an asshole. Like I would never do that kind of thing these days. And just like, yeah, you act completely different.
It's so crazy. Like, I think for me personally, I think I'm lucky enough to have at least recently not felt like I guess my morals have changed. It hasn't really seemed to change my ethics or my morals, but I do feel my desires are a little different. Yeah. A little bit more pronounced. I kind of like want to just want to have sex more.
Yeah. Yeah. I mean, I felt that too. And then I don't know if my morals like going into it were one way where I was like, at that time was like, oh, I'm an atheist. I don't care. Like humans aren't supposed to be monogamous. And then I just really let the drugs like, yeah, fuck that. Let's just like do everything that walks. And, yeah. But then getting out of that, I definitely feel like my morals kind of changed. I don't know if it's due to the lack of gear that I'm on now, but my morals definitely changed. And I started thinking more about my actions and how they're impacting others. I was like, what a fucking asshole. But there was definitely times like looking back, that's the main thing, like all the cheating I would do that I'm like, man, I don't have the time to do that now. Like, how did I have the time? Like it's insane to even think about that. Cause now I'm like, that sounds like such a drag. Like having to talk to more than one girl sounds like awful. And looking back, I don't recognize that person, which is weird. Cause in the moment I would have told you gear has zero impact on who I am as an individual. I myself, I have free agency. This isn't changing me in any way. Looking back, I'm like, yeah, I was totally different. But that comes with age too. So who knows?
I feel like running, like whenever I've felt those desires change, more often than not, at least for me personally, anytime that I feel like a desire to talk to more than one person, it's simply because like I have met, say, two people that I've connected with very deeply. And the thing is, like, normally in those situations, like I wouldn't ever really encounter a situation like that. That would be an issue. Like I wouldn't ever actually pursue like a second person and see where the connection would go if I was with somebody. But obviously being in LA, the expectations and people's intentions are not settling down or not interested in settling down soon. It's more of like, it's like playing the game of push and pull is like a lot stronger.
Yeah.
So it's like if someone's like, if you're talking to somebody and you have that deep connection, but they're not interested in settling down, I mean, it's kind of just like, there's nothing else, logically, there's nothing else for you to do.
Right.
Right.
Yeah.
Like not only should you have more respect for yourself, but like you either leave that relationship or you do your own thing too, you know? And if you guys want to continue seeing each other, then you do. And I think that's where gear makes it a lot harder.
Yeah, for sure.
Because then it gets fucking messy.
Exactly. I mean, I just made a video on this because in myself, like I was doing some self-reflection and I was just thinking about like, why did I go down that path of just being like a man whore, just a fuckboy? And then I was like, well, I had like really strong insecurity when I was a kid, like younger. Growing up, like, my brother was like handsome, lean, everything. I felt like he would call me chubby, but I wasn't, but he would call me chubby. And then like, I felt like I went through puberty and looked ugly and like girls didn't like me. And I just felt like I had a lot of insecurity. And then I grew up, like started lifting, got on the trajectory to be a doctor, started calling myself pre-med. Now I like have a nice body. I look good. And so in order to like validate myself, I would start hooking up with multiple chicks. And then it wasn't only just hooking up with them. I had to get them to really like fall in love with me because that's really externally validating. You know what I mean? When a girl is definitely like confessing her love for you, you feel really good about yourself and it feels good, And then I like amplified that by all the drugs. So I have this really crazy insecurity. Then I mix these drugs in there and I was just like, it was this dopamine hit after dopamine hit. And I would need all these girls to validate me because I wasn't, I didn't have my own self-validation. And then eventually I got to the point where I was internally validated as well and was comfortable in myself. But those two, the insecurity, which we all have insecurity if we're in this field and we're doing drugs, we're doing drugs to make ourselves look better for a certain reason.
I mean, honestly, everybody has an
everybody does. Yeah, for sure.
Degree.
But I think we take it to an extreme. We have like this inherent body dysmorphia and some bit of insecurity that we're, synthetically trying to fix via the anabolics and stuff. Like there's some people who are true athletes and only care about their performance and that's where they're doing it. But that's few and far between, especially in bodybuilding. We all care about the way we look and it's very, very rooted in insecurity. But for me, it just was a snowball effect after a while where it was like, oh, she loves me. And the drugs were fueling me. And so I was just like, it was a mess.
Yeah.
So.
Dr. Adam, you were the worst kind of fuckboy.
Yeah. Well, not anymore.
The love.
Now I'm married and dude, I can't even imagine. Like now all I care about is like my success, my business. Like I hardly have time to talk to my wife, and I've been so happy she's there, but I like don't want to deal with another female. I can't even imagine that.
Right.
Like, yeah, at this point too, I'm happy that I don't have a libido. If my libido got high, I would be like, fuck, what can I change in my like TRT? How can I lower this? Because I don't have the time to be fucking her all the time. It sounds like it's weird, but after I hit like probably 33 or so, I was just like, I don't really care that much about sex anymore, which is another funny thing that a lot of guys come in and they'll be like, my libido's down. And I'm like, yeah, no shit, dude. We're not 17 anymore. It's time to grow up. Like time to take care of your family and excel your business. You know what I mean?
You know something crazy? I'm gonna take a step and just fucking say it, and hopefully people don't judge me for this. But I have felt that way. Like at a younger age, I ended up feeling a lot less interested in sex.
Yeah.
And I'm not sure why my relationship with sex wasn't really the best, but it just kind of decreased over the time. And in all honesty, I did end up talking to and sleeping with a lot of girls over the course of the last 7 years or so.
Yeah.
And I think it just continuously dragged on to the point where it's like one after another, it just kind of started being the same thing. And it was like a lot of expansion of energy, especially if it was something that I was totally connected to or really intimate with.
Yeah. It
kind of felt like nothing. And also it's really hard for me personally to get off. Like, and I'm going to be real with everybody. Like it's way easier for me and way quicker for me to get off by just literally like fucking doing it myself rather than being with a chick. So it's like, I'm literally there for the purpose of pleasuring her. And if I don't give a fuck about her, like to the max extent, then normally it's not worth for me. And then, so at one point I was just not really interested. Like sex was cool and all, and it was but I wasn't like strongly driven. And that all changed recently in like the last 6 months.
Interesting. Yeah.
Yeah. And
I've gone through waves in my life for sure. Like you're younger than me, a lot younger, but I've gone through like really horny stints and then like down. Mm-hmm. Now I'm definitely in a valley, but I feel like it's different because my attitude around sex and relationships and everything is so different now because, you know, have a wife, and it's like when we have sex, it's definitely more of like a spiritual thing, you know, where we come together. And it doesn't have to happen every night. Sometimes a whole week goes by. And it used to be like, you know, both of us, we've been together for a while. It could have been like 3 times a day. Now, maybe it's like 2 weeks going between, but it's fine because sometimes I prefer to just hang out with her at night, talk about our future, talk about our business, you know, and that's fine. I think it's for both of us, we've matured to that level. But it is funny when guys come and they're kind of at this age, like 30 plus, and they're like, oh, my libido's down. And I'm like, yeah, I mean, it should be, you know, I really do think that we get to a point where now it's time to be the protector, the provider. We, you know, when we're like 15 through probably like 30, that's when we're just fucking spreading our seed all around. But eventually we get to that point where there's there's deeper meaning in life than to just reproduce.
Right.
And I feel like that's where I'm at now.
And I feel like that's very conducive to all our goals and everything. Because at a certain point, you know, you continue to have that same sex drive, then we kind of see some, I guess you could say, like cancellations and other things of that sort with other older men because, you know, they haven't really changed too much from like their actions in the past when they were younger.
Exactly.
And obviously everyone expects someone to change when they get in their 30s, 40s. Yeah. Maybe older.
And then you were talking about earlier, like the amount of energy that you would put into the sex, like first finding the girl, like getting her to, you know, take her clothes off, have sex with you. That's a lot of energy. If you divert that energy towards your career or something, that is massive. Mm-hmm. And then I've also found, like for me, to stop cheating, because it was hard at first. When I finally like committed to my wife now, I was like, all right, I'm not going to do this anymore. I found like that was such an excellent mental toughness exercise, like not beat cold plunges or waking up at 5 a.m. or anything, you know, like when you have girls, then when you know you can pull any girl that you want and you tell yourself, no, like don't fucking do it. That's actually like a huge mental toughness practice in my opinion, because, you know, if you have access to pussy and you say no to pussy, like that is a massive mental toughness technique in my opinion.
Yeah, no, I agree, dude. it's I think it doesn't happen too often, but
well, I mean, it does. If you were just to be like, no, I'm going to tell the girls like no from now on, but you don't have to now.
I'm just making jokes.
Yeah. But I mean, same goes for like porn, and you know, like it's the same kind of idea. because that desire to get off, to have that dopamine hit is so strong. When you tell yourself like, no, I do feel like you grow as a person. So try to abstain from like porn, don't cheat, don't fuck around. Like you can become such a better high value man, in my opinion. Different. I did not have this opinion 5 years ago, but this is my mature.
Right. Yeah. I think for me personally, I think the biggest things that changed for me, obviously sometimes libido's down and sometimes it's up, especially depending on like what kind of cycle I'm running or whatever I'm doing. At least recently in the last year to 2 years, whatever cycles I've been doing for some reason have kept me a good consistent libido. I'm not really sure why, but my hormones have been a lot more balanced in what I've been doing. So it's nice. But I think everything that's come to my perspective and how I feel about sex recently has been purely from psychological reasons. And I think some new learning and experiences, as well as meeting people that I actually am finally like really down for, really down for. So, which kind of goes off some of the things we were talking about before the podcast, but like, throughout the last 5 years, I've incurred my own sort of spiritual journey and realized, I think a lot of the things that were making sex so terrible for me was the lack of meaning. But now, after experiencing and practicing certain tantric practices with my partners, and finally feeling like a way to truly like connect through sex it's kind of just changed everything for me. So it's kind of cool. Nice.
It is. It's cool.
Now it's distracting again.
It can be. I think it's cool to have these conversations though, because I don't think that we have enough of these as younger men. And I think that it's cool to just pull girls and not think about it and just, fuck. But when you actually think about the deeper meaning of sex, like it is pretty cool that like somebody like yourself with a big following can like say that you're opening yourself up to this deeper meaning rather than just, pulling chicks and being the cool dude with abs that can get any girl he wants, no, you want to connect on a deeper level with somebody and experience something through this life. It's pretty cool.
Thanks, bro.
Yeah.
Real quick, guys. So while I was looking at the YouTube analytics, I actually saw that 85% of you guys that watch this channel are not subscribed. And I want to ask very little of you guys, but if you enjoy this podcast, if you find value in it, then please do me this one favor and subscribe to the channel, because doing so helps me get bigger and greater guests like the guests you are listening to today. Also, this channel is not sponsored, which means only the companies that I work with, which are Young LA and Huge Supplements, are the companies that can help fund this channel by you guys using the code NILE. So code NILE gives you a discount of 15% off of Young LA, and code NILE also gives you a discount of 10% off of Huge Supplements. And if you decide to purchase anything from any of these companies, it will help immensely for me by using my code. And this way, I can travel to other guests, such as Dr. Mike Israetel next week, and also upgrade in equipment to make this podcast bigger and better for you guys. Would you say that you were actually like cheating in relationships, or was it more of just like talking to a ton of multiple people?
No, it would be like cheating for sure.
Yeah.
Yeah, at times. Yeah. Damn. I mean, there would be times when it was like multiple talking to people, but then there would be times when I knew they thought that I was their only, and I would allow them to believe that. And then I would just still be fucking around like an idiot.
I see. Yeah. Well, I appreciate the honesty.
Of course.
For sure.
Now no one can cancel me in the future. I just got to get all the shit out. I'm like, yep, I've done the drugs. I've cheated. Like, what else have I done? Now, if I ever blow up, you can't ever write a New York Times post on me.
That's one of my favorite reasons for having conversations with you, though. Because you're literally like, I don't know very many other doctors where I could just literally just shoot the shit about the craziest shit that we've done.
Yeah, dude. I mean, there was a point, like when I was first going to go on the Mark Bell podcast, it was the first, social thing that I got invited to. I remember like I was in, all my best thoughts come to me in the shower. And I was in the shower of the hotel before going to the Mark Bell podcast. I'm like, how am I going to do this? Am I going to play like the stuck up like scientific doctor, or am I just going to be fucking honest and be myself? Because I'm just a bro at heart. And I'm like, fuck it. You know what? Like, it's going to come out, And I hadn't even told my friends at that point. Like, I was a fake natty, to be honest, like for years. I never never told anybody, because it just came up in a different time. Nobody was openly talking about it. So when I started, like, I was, in the deep end of the forums and none of my friends were doing it. And I was like, fuck it. Like, I'm just going to do it, but I'm not going to tell anybody. So I didn't tell anybody. And when I went on that Marbell podcast, I was like, whatever, I'll just be open. Because it felt like there was a large weight on my shoulders all these years, like lying about stupid shit. Like
yeah.
that. And then it just felt so good. Like I had friends text me after, they're like, dude, you were running gear. And yeah. It was funny too. Cause like, you know, so many friends would be like, bro, you're getting some sick traps. It almost looks like you're on shit. And I'd be like, yeah, imagine that, you know, like for years. And then I would just be like, yeah, I don't know. Just try to, you know, change the conversation, but it felt so good.
Try creatine?
Yeah. Tried it once, twice. Yeah. So I'd be like, oh yeah, the creatine's hitting. Yeah. So it just felt good to be open. I would tell everybody, just don't live in lies, dude. It fucking sucks. It feels so much better just being honest and open and being real, especially if you're going to put yourself in the limelight, like of social media, which everybody is kind of out there now. You want to try, I think, be as transparent as possible, which I love the podcast and the name for, you know, it's so cool. Yeah.
Thanks.
It's true. I mean, it's a double-edged sword these days because so many people are too open kind of in a way. And now we're taking it to the extreme where like, you know, kids doing injections on freaking their TikTok and their reels and stuff. And it's just like, they're growing a platform off of that. And it's like, okay, now this is like gone too far. It started with like Derek being like, I'm going to be open and talk about how we can do risk mitigation. People like yourselves, like, let's be transparent about what we do to look this way. And now it's just gone to the extreme. Like, now let's just be fucking idiots and pound like, you know, 20 tadalafil before our workout and inject ourselves in the chest and like, you know, just put the grain up super high so we look leaner than we are. And just make a stupid video. Like, it's just become this whole culture of kids just like, you know, glorifying the use of these. And like, it's gone a little too far now. But no, I don't give a shit about anything anymore. It's awesome. Like, I'm just going to do whatever the fuck I want.
Fuck
like,
yeah.
And it feels so much better. Like, I'm just going to wear whatever clothes I want, rock a mustache.
I've been the same way about everything but the mustache. The mustache I did experiment with, but then I kind of looked a little bit, I looked less Asian. I looked more Mexican. So I think that's kind of the bigger reason why I just decided against it. But
racist.
But I've been wanting to get a lot more tattoos my entire life.
Oh yeah.
But my entire life I didn't, for the sake of my family and also professionalism and what my parents would think, you know, regarding honor and Asian culture. And then I said I don't give a fuck.
Yeah.
So here we are.
I got a few tattoos, but tattoos are hard for me because I change so much that I'm like, I don't know if I would like the same thing in a few years, you know. So all of my tattoos are words that like meant something to me at the time. So looking back, I mean, they still mean a lot to me, which is cool. So I never wanted to get like any images though, because I never thought that I would love any image my entire life. If that makes sense. Okay. Yeah.
Do you still not?
Still not think that?
Do you still not love any images?
Oh, I mean, not any that I would want on my body. You know what I mean? But I love all the words that I have because they all still resonate, you know, very strong with me. So it's like they're all cool. They're all Latin. They're all like just little sayings that are definitely like my motto for living my life. And I think I always will be that way.
I have more text than I have anything else. Text and then I have a few symbols.
Oh yeah.
But as far as
symbols like are cool too, because symbol is basically like a text, you know. I think. Don't you? Would you agree?
I think so. Yeah, I have a few like spiritual symbols and some other like the Sri Yantra Hindu symbols, and then what else do I have? Some other stuff.
Nice.
But anyways, but from our last conversation, for me, I've never really had people or had friends to talk to about these things either. And that's where I realized it caused a lot of issues with my life, because as I was getting into prepping and bodybuilding as a natural first, it was obviously difficult and I didn't want to start on gear. But whenever I did finally have the chance, and I did, the only guidance I had was from the coach I had, who simply just gave me the stuff and told me to take it.
Yeah.
But there was nothing else there. And that caused a lot of really, I want to say traumatic. I don't want to overuse the word trauma because it's not traumatic, but it just caused so much pain and so much stress and so many issues.
Yeah.
Especially, you know, long-term side effects, such as like I wasn't able to really come back properly. You know, the balls were just not the same.
Right.
Balls were just not the same.
Yeah.
And it wasn't until like when I moved to San Diego and I started getting closer to some other people there, where openly engaging with them about gear and PEDs made the journey so much easier.
Absolutely.
Like in the combination of doing research online and also speaking with friends that were near me and hearing all their anecdotal evidence and experiences that they've gone through, kind of just created this whole pool of just info for me to pull from.
Yeah.
And like it makes it easier because sometimes, you know, you jump on like a bodybuilding forum and you see some shit and like half the time you're like, what the fuck are these guys talking about?
Exactly.
Sometimes they're just like some things that'll apply to them will not apply to like 50% of the other people.
That's very true. Yeah.
Whereas like if I have a good amount of like experiences from people, you know, plus I could see like, oh, my best friend, he seems to react more similarly to things than I do as the other friend. Like I can pull information that way as well.
Yeah.
And in doing so, it's made it so much easier. So that's kind of why I wanted to create this platform too in the first place, is like just having an open form conversation where people can just absorb more info and hopefully it makes things make more sense so they don't have to fuck themselves up like most of us.
Yeah. Because I did for sure. All I had was the forums. You know, I'd be on like, I don't even know all of them anymore. Professional Muscle, who knows all the rest, but all of those like underground, you know, friggin' like dark web, not really dark web, but just like, you know, those niche sites of forums. And I would just be researching those all on my own. But you build it, you learn a lot that way for sure when you have to go down that road of like, you know, self-education. Learned a lot, but it was like you mentioned, a really good thing to see is how it affects other people. And sometimes the people posting about it, you know, they're like these top elite dudes and you're like, fuck, they're having that response, but I'm not. And then I was always in this like cycle of, I'm not getting the results that like Niles getting. Like that guy's fucking jacked and he's on. My stuff must be like underdosed. Maybe I should just increase it, or my source isn't good. Maybe I should just get a new source. And I just always was trying to look like guys that I was looking at online. And now like with my platform, I'm always trying to tell guys like we're not all equal. And some guys are going to respond just by looking at a fucking vial of testosterone and they're going to blow up. And then other guys can run a gram a week and not even look like they lift. You know, most of the guys that you see in the gym these days are on a good amount of gear. Not many of them are impressive. You know what I mean? So genetics play such a huge role. Like I was never, like I had a decent physique. I definitely looked good. I was big at the gym. People thought I lifted and everything, but I was never going to be like, have a pro card. Just wouldn't happen because I just don't have the genetics for it no matter what. And there are a lot of people who kind of inappropriately chase that dream thinking that they are going to look like X influencer. And these days too, like a lot of the influencers just are sponsored by TRT clinics and say, oh, I'm just on TRT. And, you know, guys want to hop on TRT. And I'm like, why the fuck would you take your 700 testosterone, your natural, hop on TRT to get a TRT induced 700? Like, you're so stupid. You're going to shut yourself down for that because this guy says he's on TRT and we know he's not on TRT. You know what I mean?
Yeah.
Yeah.
Yeah. I know what you're saying. That makes it definitely really frustrating.
Yeah,
for
sure.
I've had a lot of friends come up to me too, asking me about like whether or not they should just do TRT or something, or do something a little bit more. And I'm like trying to explain to them, like, bro, like if you feel good and you don't feel any sort of depression or like lack of motivation or anything, there's literally no reason for you to jump on this. Like if you're gonna jump on anything, I don't want to condone you jumping on anything at all. But if you really had to, it might as well be at least like a low cycle. Yeah,
100%. You know? Like why would you go? Like I said, why would you take your natural physiologic good range and just replace it with an artificial physiologic good range? Like you have no net positive there. You've just taken your 700 and now made it a synthetic 700. At the end of the day, the gains are pretty much the same. So yeah, I would say go on the cycle if you feel like you have the need to do it. But for some reason now, so many people have conflated TRT with steroids. We know they're different. I hope other people are starting to realize that, but so many young guys are like, yeah, I think I want to do TRT, as if that's like the first cycle. And I'm like, no, that's not the first cycle. And once you do that, you're stuck. Like, do you realize that? And this whole conversation, like earlier, you know, I'm not who I was when I was 25. Now that I'm about to be 35, I'm sure when I'm 35, I'm going to be, or 45, I'm going to be completely different than I am now. But a lot of younger guys never think about that. We never think about our future self. If I could go back, I wouldn't have fucking wasted my time doing that stupid shit because it didn't get me. Maybe I would, because I have this platform and everything because of it now. I did make that comment once, I think on.
Yeah, I heard that on the podcast.
Yeah, I think I said like, oh, I wouldn't do that, and somebody in the comments was like, dude, if he wouldn't have done this shit, he wouldn't be on here. I'm like, oh,
if you didn't do PEDs or like steroids, PEDs then you wouldn't be able to talk about your experiences.
Exactly. Yeah. So I guess I don't regret it, but it's like, it's kind of a roundabout way to become like successful.
Yeah, right. No one should just take steroids.
Yeah, like,
just
hey,
so they can
fuck around, do some stupid shit, and then maybe one day you can talk about it. Like with that, I mean, you might as well go do all kinds of like heroin and stuff. Who knows?
All kinds of heroin.
Yeah.
Oh man.
Be a bum for a little bit, and then you can talk about it in the future. But yeah, so I mean, honestly, looking back though, my ideals, I've changed so much that I just don't care about that kind of stuff. Like I said, I don't give a fuck about much anymore other than like making money and being successful. Like I wish I didn't spend so much time and money and effort on the gear because I'm not that same person anymore. But that's me.
Gotcha. Real quick.
Yeah.
By the way, guys, we are with the host of the podcast, Atlas Hour.
Yeah, actually, I'm not doing the Atlas Hour anymore.
Really?
Yeah, I just switched it over to my name, Dr. Adam Hotchkiss YouTube channel.
Oh, no shit.
Yeah.
Nice.
Yeah. Because I was doing the Atlas with a buddy and then kind of fell through.
Okay.
And then I was like, And then Derek's like, dude, just make your channel your name because you can search it.
Yeah.
Yeah, that's probably a good idea.
Yeah, yeah.
Switch it to my name. So you can find me in my name.
I know for a fact that Derek's always thought about like, man, I wish my More Plates, More Dates name was a little bit more professional.
Absolutely. Yeah, he brings it up all the time. He's like, man, now that I'm older and also in the same boat as me, like he doesn't do cycles or anything anymore. He's like, now I'm stuck as More Plates, More Dates.
Right.
Which kind of sucks when you're running around with the Hubermans and the Atias of the world who are like, Dr. Andrew Huberman, and he's like, yeah, More Plates, More Dates. You know? Like, but hey, it works, whatever.
Right. Well, everybody knows him as that. Plus, MPMD sounds kind of cool. It sounds like you got a degree.
That's true. It does.
That's what I thought it was when I first saw it.
I used to see that and be like, who is MPMD? Because I didn't know at first. And then later made sense. But I thought it was an MD. Yeah.
Well, host of the Dr. Adam Hotchkiss YouTube channel. And specialist hired by More Plates, More Dates. Dr. Hotchkiss specializes in health and performance optimization and body composition, and also has, of course, obviously had a host of personal experiences with PEDs and anabolics. So, and do you still compete in powerlifting?
Nothing anymore.
Nothing anymore?
Yeah. Now I just pretty much do a lot of like coaching on stuff like this, you know, more towards a lot of probably like 25 to, 60-year-old guys who just want to be a better man, essentially, and do a lot more preventative medicine more than anything now. Definitely work with athletes, and I love working like risk mitigation is probably my favorite thing, because those guys like a guy like you who would come to me like, dude, I'm already doing this stuff. Just keep me healthy while I'm doing it. I love that. It's like, what I really don't like is when guys come and they like
lie.
Yeah, they lie. Exactly. They're like, oh, I've got these symptoms. I'm like, no, you fucking don't have these symptoms. And all I can give you anyway is TRT. And like we said, it's not going to fucking make you anything that you want to be. So I much prefer, I love the risk mitigation stuff because I wish that's what I had. And that's really my passion is like, how can these elite athletes take stuff to the extreme and do it safer, at least?
That's perfect because it's exactly what I want to know about.
Yeah, let's do it. Yeah.
Well, honestly, we can just talk about the other stuff later because I have a lot of things I'm curious about, of course. But as far as risk mitigation, I guess, what is the work that you've done regarding risk mitigation recently in the last, couple of years or so, or as this has become like a priority in your life? Yeah,
so I think a lot of guys, well, when I started, now are a lot different, but when I started, we didn't really talk about anything internal. I kind of like separate the side effects of anabolics of like the aesthetic side effects, which is all anyone used to care about. And then we have like the actual internal things that will impact your longevity. And we always used to talk about like, I'm going to, lose my hair, going to get acne, going to maybe get some man boobs. Maybe I'll have an elevated blood pressure. That was like the one internal thing that you would hear about and nobody stressed about it. And I was not experiencing any of those things. So I was like, I can run the doses higher because no one was talking about all the internal stuff. Diving deeper into the literature, I find that, we're greatly increasing our risk for ASCVD, atherosclerotic cardiovascular disease, for, neurodegenerative disease like dementia and Alzheimer's, metabolic diseases like diabetes or metabolic syndrome, things like that. And all of those kind of impact each other and just shorten our life essentially. Which is crazy because most of us got into this field because we're really passionate about health and living a healthy, long life. But then we're doing the exact opposite. Like I just saw something recently, Greg Doucette was comparing like a bodybuilder saying they're equal to obese people. I would probably agree. Like it's probably pretty accurate, comparison. So, I mean, I think it's true. And so when I talk to guys who come in, I'll be like, all right, we'll talk about the aesthetic stuff. Cool. That's easy to control. But how are we going to mitigate these risks? So cardiovascular, two big things. One, blood pressure for sure. And that's like probably the crux of a lot of bodybuilders' issues is their elevated blood pressure. Not only does it, damage their cardiovascular system, but it can impact their kidneys, it can impact their brain. So first, let's control blood pressure for sure. I don't know if you want to dive in any deeper on that.
Yeah, I would love to actually pause right here and bring up something personal for you in the audience. I don't know if I've discussed this yet, but a recent occurrence, I have been measuring my blood pressure regularly. My blood pressure has always been very great. This is one of the things I think I have luckily in my genetics. My dad seems to have high blood pressure. My mom seems to have it low. And I think I've teetered a little bit more towards my mom's as of recently. But now that I've been running like a real bulking cycle for Olympia, like I guess the first real cycle, like in terms of like pro competition that I've ever done, my blood pressure has obviously risen to slightly above 130 over 70. So this has been a big concern to me, and went to my doctor, asked him if I could take anything such as lisinopril or telmisartan or whatever. He actually advised losartan or telmisartan over lisinopril because I think a little bit less side effects. And then he also suggested one more, I don't remember, it starts with an A, that isn't kind of like a diuretic, kind of like telmisartan or losartan is, but could potentially increase your water retention. I don't remember what it's called. I could probably just look for it if I really need to. But basically, he suggested these, and I'm like, okay, I really want to take one now because I want to at least maintain like a lower blood pressure than, the maximum I should. But then he said that he wants me to stay off of any of these medications since I have about 3-4 weeks left of bulking, and then I'm going to go into prep, and then I'm probably going to go into my show. I'm planning to do the show in August 10th. So
what's his rationale there? That you're going to self-correct in a few weeks?
He's trying to suggest he doesn't want me to take any of the medications until after I finish competing, because he says that it's going to take some time for me to, I guess, adjust to the medication, and medications such as telmisartan and losartan can really affect my kidneys. And at least he, and I guess he said another doctor he talked to, say that all the stuff that I'm probably going to be running for my prep, including being on prep and then probably also jumping on diuretics right before the show, he thinks is going to be not. He just basically says like I should not jump on the medication because of the effects on the kidneys.
I would personally push back and say that they're going to be kidney protective, and for the bulk, especially something like telmisartan. It's an angiotensin 2 receptor blocker, and they have awesome impact on the kidneys. I mean, just reducing blood pressure is going to have a massive positive impact on your kidneys, but there are renal protective attributes to it as well. So I would say I think it would actually be a positive thing for your kidneys.
Okay.
And for probably your body composition. When I actually started running telmisartan was probably 5 years ago, and I was taking a shit ton of growth hormone at the time. I think like 12 IUs or something.
Holy shit.
Yeah, it was pretty, and I was just bloated like crazy. I got so bloated. I had cankles. I was like, what the fuck? So I knew the physiology, and I'm like, I think this growth hormone is kind of activating, stimulating the renin-angiotensin-aldosterone system. I can take telmisartan to offset that, and the water just, I looked lean as hell. So it was my way of just looking lean, actually. I didn't even have elevated blood pressure.
Right.
So I felt like my body composition was way better, and I also reduced the volume.
That's what I was expecting, is I would come in drier if I started taking those. I guess is also why I didn't push back so much, is because I'm like, he is right. If I'm about to jump on prep, I'm going to induce all these changes. I'm going to become drier as is through prep and whatever else I'm taking. Like, is he right that it is going to put an extra stress on my kidneys? That like it'll take time for me to adjust to the medication. So he advises
I don't know,
longer period of time, but
I feel like I still would rather. I've worked with a lot of top dudes, like John Jewett's one. Him and I have talked a lot about this. I know he has his athletes run telmisartan all the way through too. He does himself, and he brings an awesome package, and so do all of his athletes. So I don't know. I feel like it would be a positive thing. Like I hate waiting. One thing that I see a lot of times in standard medicine is they will say like, let's wait until it gets so bad that like now we'll introduce it, you know, like heart disease is a prime example. They'll always tell guys, stay off cholesterol medication until you're older, until your risk is higher. Like, do we tell people to keep smoking until you get lung cancer? Because that's the equivalent to what you're telling people to not lower their cholesterol until their risk is higher of heart attack. It's insane. So they'll be like, oh, your arteries are clear now. You don't need to run any cholesterol medication. I mean, that's literally the same thing as saying, oh, your lungs are clear, no lung tumors, keep smoking all you want. If you get a tumor, we're going to tell you to stop. Like, what the fuck? That's just, yeah, they do that a lot in Western medicine, which is weird.
I guess the one pushback that I have to that is I'm sure that they like, at least like with the analogy of smoking, their concern obviously is like the side effects of the medication that you would be taking, right? Versus like if you stop smoking, hopefully there aren't really any bad side effects that will incur from not smoking.
Well, you would have a higher risk of Parkinson's now if you quit smoking, because smoking can lower your risk of Parkinson's and demantia.
Really?
So, yeah. So, I think I can always find a way to be like, But,
nice. Yeah, man, I don't know. I'm thinking the same thing. Is like I would rather just start lowering my blood pressure now, even if he says that like 4 months or whatever is not gonna make hardly any difference in my long-term effects to my cardiovascular system and cardiovascular disease with blood pressure like that. But
but I would say you're in this for the long haul likely, and you're probably going to be doing at least 5 more years. I don't know what your trajectory is, but you're going to be doing it for a while. You should probably try to reduce all of the risk that you can.
Right.
What I would say, because you can't like our kidneys don't heal after they're damaged. They're not like our liver, but our kidneys, our kidneys get scar, they get scar tissue, and they're pretty much screwed. So when we have that really elevated blood pressure blowing through our kidneys, we end up with kidney failure, and that's not something that you recover from.
Do you know what it is exactly the effects on the kidneys that telmisartan and losartan have?
Usually net positive, like I was saying. I don't know, what
he might be.
Yeah, maybe an increase in potassium, because they can cause hyperkalemia, excess of potassium, but usually not. I mean, they're pretty benign. So yeah, I'm not sure. Okay. And I would say too, like most people, I don't know what your cycles would be like. Most people run more gear through cutting than they do through bulking. Like that's actually, so your compounds are going to get higher, and I would say your blood pressure is going to get higher probably through dieting.
Exactly my concern too.
Yeah. I don't know. I hate to ever say, oh, your doctor's wrong to anybody, because I don't know the person. So he probably has a really good rationale that I'm not, thinking of.
Yeah. You're wrong, bro.
No, I didn't say that.
Oh, shit. Okay, cool. What about the other things? The other risk mitigation?
Yeah. So along with blood pressure, we're still in the cardiovascular system. Like I alluded to, the lipid lowering is huge, because most of these drugs, even TRT alone, will elevate or cause like a dyslipidemia of sorts, where it reduces HDL, and that's our high density lipoprotein cholesterol, and it will increase our LDL-C, our low density lipoprotein cholesterol. It can usually cause some skewing there. So you want to try to get that LDL as low as possible, in my opinion, as early as possible, so that we can prevent the plaque buildup from occurring. And then that way we're not having, an ischemic event like a heart attack or a stroke or something like that.
Right.
So those two are huge. Cognitive function is one that I'm really big on too, which I never thought of. And one of the reasons that I kind of stopped was I literally felt like I was getting stupider. I couldn't articulate my words. I felt like I had the thought on the tip of my tongue, and I just couldn't articulate my thoughts very well. My verbal acuity was significantly declined, and I'm like, damn, I think the drugs are making me stupider. And then I started diving into the literature, and lo and behold, there's a ton of data to support that all of these anabolics, including testosterone, actually are highly neurotoxic and cause significant neurodegeneration. So that's a huge thing to consider. And what I found, in the literature, the thing that seems to be the best at offsetting that is having elevated levels of estradiol or estrogen, which a lot of guys, lower, but like testosterone, most of the benefits, in my opinion, from the health benefits of testosterone are via the increase in estradiol, because that's, neuroprotective, cardioprotective, can actually improve our libido, can improve our body composition. So a lot of guys will lower their estrogen significantly low, and, they're reducing those neuroprotective benefits that they could have had.
Yeah.
And then they're running all these nandrolones and tren and things like that are highly neurotoxic, which is crazy.
I did that for 2 years.
Yeah.
I had an estrogen level of 14 or below for 2 years. Every day I continue to bodybuild, I think about those 2 years and what I did to my body. And like, I wonder if I've already pushed myself over the edge.
I'm happy that I don't know. I was coming up when I started, like we just started talking about like blast and cruise. And I always tried to really be on like the tip of like the literature, and guys were starting to talk about like, we don't need AIs. And so I just never took them. I actually didn't feel good whenever I introduced it. I remember looking back at lab work, and sometimes I would have like estradiol of like 100. I felt fine. Like, you know, if my testosterone was up at like 3,000, estradiol of 100, but I felt fine. And like, I actually probably had a lot of protective benefit there, luckily.
Yeah, that's insane. You didn't feel anything though.
Yeah, I'd have a little bit of nipple sensitivity and things sometimes, you know, but like I never had like full blown gyno, luckily. I still like feel like there's a nodule in there somewhere if I, you know, search it.
God, dude, I had fucking flashlights on 50.
Did you?
Yeah, dude, it was terrible, bro.
Like when I first would introduce a cycle, like you go from your cruise into your blast, and always get like that would happen to me now. If I increase my testosterone dose 100 milligrams, I would feel sensitivity there, which occurs all the time. And one of the biggest things that drives gyno, in my opinion, is the fluctuation.
The fluctuations, yeah.
Yeah. So if we can keep our levels more stable, even when you're blasting, usually greatly reduces the side effects.
I think that's actually one of the, I think we were referring to me feeling like my hormones were a lot more stable in the last like 2 years or so of cycles, but I've also been injecting every single day because of those reasons.
I would urge like everybody, especially when you're going to do those high doses, because otherwise you're on a roller coaster. I'd rather you bring it high and stay stable than like spike, drop. Like that's awful. And that's, you know, that's what drives a lot of the side effects, at least the aesthetic side effects that most people care about. But even the internal ones too, that can have a massive negative impact, like blood pressure, for example.
Gotcha. What other risk mitigation?
So the other one that's kind of interesting too would be metabolic health, which again, all of these tie in together. But metabolic health meaning like how well you're dealing with the food that you're taking in. And I found, you know, you would think like, oh, a bodybuilder is going to be the furthest away from diabetes because he's so chiseled, he's so lean, but just the sheer impact of all of those calories that the person needs to take in usually develops some bit of insulin resistance and, you know, potentially even diabetes. Like the amount of top level Olympia pros labs that I've looked at who are actually full blown diabetic, like most of them usually. So having something in there, whether it be, you know, if you just want to stay with like supplements and like, you know, things like berberine or something, or more like metformin or canagliflozin or something like that, you know, I would definitely implement those early on, especially in a bulk for sure, because you're just taking in so much food. Or insulin is another one that a lot of guys will utilize. Insulin, I think, is gaining a lot of popularity again in the safer use kind of community, in hopes to potentially like offset some kidney function, like, you know, beta cells burning out and stuff. I don't necessarily believe in that science, but I do think that it, you know, has its place, like using something like Atlantis or something in that regard, so that you can just help to shuttle those carbohydrates in, but it won't help on the insulin sensitivity side of the coin.
Insulin doesn't help on the insulin sensitivity side.
No, I mean, if you're just pumping more insulin in, you're potentially making your insulin resistance worse. But you are helping your beta cells of your pancreas to not kind of burn out, because that is what can occur sometimes. So in diabetes, usually in a normal person who experiences diabetes, usually they'll have insulin resistance sometimes for a decade before ever even pre-diabetes. So the insulin resistance, for those of you listening who might not know, is basically the insulin will shuttle in glucose into our cells. And, you know, the insulin is the thing that starts that shuttling process. When we have insulin resistance, those cells are no longer responding to the insulin. So you have to have higher and higher levels of insulin to get the same amount of job done. So your cells are resistant. You're no longer insulin sensitive. So again, if you're a bodybuilder and you're shoveling in a ton of insulin, potentially, theoretically, mechanistically, you could be increasing your insulin resistance, but you are helping your pancreas, which produces insulin, to not have to produce so much. Because another side of the coin is that in diabetics, like type 2 diabetics, sometimes their pancreas, those beta cells that produce it, actually burns out, and they have, you know, kind of a non-functioning pancreas. So you can help that side.
Gotcha. Yeah. What are your thoughts on the discussion of berberine and metformin blunting hypertrophy through the mTOR pathway?
Yeah, I think it's minimal, if anything. Again, the amount of IFBB pros that I've seen actually taking metformin, I would be like, obviously it's not hurting them. I've heard rumors like Matt Jansen's camp uses a lot of metformin. He makes some amazing looking athletes, There's one study on metformin and like blunting hypertrophy, and it just doesn't fit into the population that we're talking to. I think they were all above the age of 65, I believe. I think they were taking in somewhere around 50 grams of protein a day. So already, like, there's old dudes who
50 grams.
50 grams of protein. Like, most guys are getting that in breakfast. And then they were taking 1,500, or maybe it was even higher. It could have been like 1,700 milligrams of metformin. So it was much higher than the standard 500 that the bodybuilder is going to take. So it just doesn't translate over. And again, like when we're looking at real life, like so many bodybuilders run metformin and look amazing and grow really well on it. Powerlifters too. So I personally wouldn't really buy into that unless you're, having really reduced protein intake and you're taking a shit ton of it.
Okay. Do you think any claims of not ingesting like metformin or berberine anywhere between like, I don't know, say like 4 hours of your workout makes any sense?
Yeah, that makes sense to me. I mean, might as well be safe. Yeah, I do the same. I tell people to do the same with like glutathione, for example. Yeah. So I'll be like, don't put this near your workout because that inflammation around your workout is positive. It's just like not doing a cold plunge immediately after a workout because you don't want to blunt that inflammatory response right then. So yeah, I mean, I don't know if it would make any difference if we actually studied it and did like a randomized control. But shit, it would make me sleep better at night that I didn't, blunt mTOR around to the workout window.
Yeah, that's what I was thinking too. So that's, I just have like a berberine supplement. It's called
whatever it is, use your code.
Right here.
There it is.
Oh shit. It's called Utilize.
There we go.
From Huge Supplements, and it's the only thing I take. But got like berberine and cinnamon extract and some other stuff, and it's got like a dose of like 1.5 grams of berberine, I think, on a full dose. But yeah, whenever I take that stuff, I also try to like take it like not within like 4 hours of my workout.
Yeah.
Do you ever feel have you taken berberine?
Yeah, it fucks me up.
It fucks you up?
Yeah, I can't take it. I can take metformin fine, but berberine, awful experience.
Okay.
Yeah.
How so?
I like literally will shit my pants and throw up all over the place.
Oh,
I told this story on Foo Ads podcast.
I think you said this on the last podcast.
Yeah,
me too.
Yeah, literally. Like I was taking berberine and just kept thinking I was getting food poisoning like repeated days in a row, like an idiot. And then I'm like, you know what? I think it's the berberine causing this.
That's crazy.
Yeah, and the last time like I was eating full blown bro at that point, I think I had like pasta and tuna, and it was like, and I went to get a massage right after eating my meal and popping the berberine. And then I was getting a massage with the worst bubble guts ever. I was fucking dripping, like, oh fuck, like trying not to shit all over the lady, trying not to throw up through the hole.
Shit.
And then like, as soon as she was done, cause I felt like really embarrassed to interrupt the massage. Like, hey, I gotta go shit, I was like, I should have done it, but I was just like, I'm going to tough it through. So I'm just sitting there like in agony, and then finally ran to the bathroom and just threw up all over. Like I had to clean up their bathroom.
Fuck.
It was embarrassing as fuck.
That's crazy.
Yeah, crazy. But then metformin, can't even tell that I take it. Like it was an insane reaction, to be honest. Like my wife was literally
that is pretty crazy.
Yeah, she was like, we need to take you to the hospital. She thought I had like an issue, like pancreatitis or my liver was failing or something, because I was just vomiting for days on end, like just hugging the toilet. Right. Awful.
I know some people are intolerant to it, but
I must be.
Yeah, I feel like you're just like severely allergic to it.
I also like talked to who was it? Justin Harris, the coach, the IFBB guy. And he said the company that I bought it from is known to be really shady, and they have a lot of other shit in there that I could have. So I was like, oh, okay, maybe I got something gnarly.
But you're too scared to try another.
Yeah, I don't want to fuck with that. Like this. Like now, I hardly eat anything at all. I'm so insulin sensitive.
Yeah,
I'm like,
you don't need it.
Yeah, I'm just skinny and shit now. Like I don't care. Like, I'm good.
You don't look skinny in that shit though, bro.
Lucky. Good.
Yeah, I'm okay. Yeah, I was wondering, since I know a few people have varying experiences. Luckily for me, I don't really have any issues with berberine, so that's why I stick to it. But I don't really know how to get metformin right now anyways.
Oh, really? So, I'll get you taken care of.
Nice.
I'm actually trying to make a platform right now for guys like ourselves who could just like go on and buy some like metformin or telmisartan or enclomiphene or carnitine or.
Oh, wow.
Yeah. So kind of like a Hims for bros.
That'd be dope. Yeah. Hell yeah.
Should be coming soon. I was going to wear the hat and rep the company, but I'll wait for a little bit because I haven't made the announcement yet.
Okay. All right.
This is it. It's coming soon.
This
you guys
is the announcement. Yeah. Let's go. Cool.
I'm going to try to steal Niall, but I don't think he'll come. He's got a good company already.
Are there any other ancillaries or anything that you think people it would be valuable for people to take, just like glutathione?
Yeah, glutathione's great as a just kind of an antioxidant for most people. But bodybuilding, I mean, yeah, in bodybuilding, you have a lot of oxidative stress. So you want to try to reduce that. But yeah, anything that's going to help to lower your glucose impact and have some glycemic control, like the berberine or metformin, something to keep your blood pressure low. I also am a huge fan of melatonin, like really big fan of melatonin for its cognitive, like neuroprotective effects and its antioxidant effects. So yeah, it can help in sleep for sure, but it's probably our body's right underneath glutathione would be our body's most potent antioxidant. And the cool thing about metformin is when most things are broken down, they're an antioxidant for a little bit, and then they're broken down into another metabolite that isn't an antioxidant anymore. Metformin is like antioxidant. So the whole time it's in your body, it keeps getting broken down into more antioxidants and more. So it just is a massively powerful antioxidant. I take high doses of it for that.
Wait, are you talking about metformin or?
I'm sorry, did I say metformin? Yeah. Melatonin.
Melatonin. Yeah. Okay.
Yeah,
That's what I say.
Yeah, melatonin. That's the one.
Gotcha. Yeah. Okay. Are there any other ancillaries that you recommend for neuroprotective reasons?
Anything that's going to like reduce oxidative stress. And then also, you can look into nootropics and things. So any choline donors like, alpha GPC, those are all going to help to increase your acetylcholine, or you have something like huperzine A, which is an acetylcholinesterase inhibitor. So it's blocking the breakdown of acetylcholine. Those will help for sure. And then also another thing that I don't think enough of us do is try to do new things and try to work on our brain. And that could have been my issue too. I mean, a lot of people, I just don't think that we do anything, especially in bodybuilding. We get so myopic on all I'm going to do is lift and read lifting material and watch YouTube videos on lifting. Like I think you're a musician, right? Like I've seen you play the piano and everything. Like stuff like that is so good for your brain. My wife and I just started doing crossword puzzles every morning because it helps a lot. Sudokus and things like that, because we need to train our brain too. And if you're not training that, then you could potentially be having neurodegeneration just by, atrophying of those cells.
Wow.
Yeah. Okay. So keep playing instruments or learn something new, go do a martial art or learn a language. Like that's huge. We're always looking for the supplement, and the nootropic helps, but it doesn't help unless you do the work. It's the equivalent of running gear and not going to the gym. So a lot of us are taking these nootropics and hoping that we're going to get smarter, but we're not working our brain. That would have the cause the neuroplasticity to occur.
Mm-hmm. Okay. So glutathione and melatonin being your top two, are there any other ancillaries that you would recommend?
Just in general, vitamin D would be another one for sure. Most people are vitamin D deficient, and that has a host of benefits. And I would say couple that with K2, especially in the bodybuilder. There could be potentially some cardiovascular benefit to adding the K in, because the vitamin D will kind of liberate calcium and increase levels of calcium, and the K can kind of grab that, ensure that it's not going to be deposited in, say, our arteries and be deposited more in like bone. So D3, K2, I think most people, bodybuilder or not, should be running. Creatine, obviously too. That's another one that I would say, bodybuilder or not, just run your damn creatine, because there's so many benefits, even if you're not a bro, just the cognitive benefits, the potential like antidepressive benefits. There's so many benefits to creatine.
Right. Cool.
Yeah.
I may or may not be creating my company with two of my favorite substances.
Oh, hell yeah.
Creatine and candy.
Nice. That works. That's awesome.
Secrets.
All right.
Okay, cool. What about what are your thoughts on like citrus bergamot and astragalus and any of those things?
Yeah, I mean astragalus,
their potency compared to the rest.
So astragalus, I think, might as well just add it in for kidney protection. Citrus bergamot, I'm just a huge fan of lipid lowering drugs like ezetimibe or even statins. So if you have access to those, run those. If you don't, citrus bergamot may work. Nattokinase is another one. So nattokinase comes from the food natto and can help to lower LDL cholesterol and potentially lower like clotting. So if you're not going to run pharmaceuticals, I would say citrus bergamot, nattokinase for sure.
Nattokinase.
Yes.
Okay. Yeah. That's something I don't run.
Have you ever heard of it?
No, I don't know anything about it.
Yeah. So it just comes from natto's an Asian food, isn't it? This is me being racist, being like, oh, the Asian guy. Have you heard of that? Like natto?
No.
Oh, I think it's, I don't know, I might be wrong, but I think it's similar to like tofu. It's a fermented food. Like, I think it's big in Asian culture, and there's been hypothesis that like the Asian countries who have elevated lifespans, who live longer, and maybe contributed to their natto intake, which is like kind of been debunked. But that was a thought for a while because it does help to lower LDL and also help lower that clotting risk.
Okay.
Yeah.
Cool. Here's that, guys. If you guys interested in any of these products, link below.
Yeah.
You jump in Scott.
Exactly.
Except for nanokinase.
Yeah, you guys are going to have to get some natto.
Can you just get that off of Amazon?
Yeah.
Yeah.
For sure.
Okay.
Yeah.
Cool.
And I don't know the dose of it. Go to examine.com for that.
I'll look into that. Yeah. Okay. What are your thoughts on like cycle supports? Because there's a ton of them out there,
Yeah.
Like things that have extra, like, I mean, yeah, I think Tedka's a good thing, right?
Yeah.
Tedka's super valuable, but like there's also a lot of cycle supports that have like excess stuff like saw palmetto and NAC and some other things.
Yeah.
What are your thoughts on those?
Like I like the NAC. I don't see the purpose of running saw palmetto. I mean, like if you want to lower your DHT, which seems stupid in the sport, I would keep your DHT higher. So yeah, I mean,
for what reason?
Just for the strength, the aggression, the libido, like all the benefits of DHT, in my opinion.
Okay. That has me thinking, because I've been running finasteride for some time now.
Yeah.
I didn't feel side effects, but I have not felt any. I used to feel some crazy DHT effects back in the day when I was running higher DHT gear. Like I was running Primo and Masteron at the same time at one point, so I was feeling like a lot. I don't feel that stuff anymore, which is kind of nice. And my hair is staying, which is good. But sometimes I wonder, because I know a lot of other people there's people that have had bad experiences with finasteride as well.
Yeah, for
and
sure.
So I constantly I'm constantly mindful of that as a concern.
Yeah. As a whole, I'm super anti 5-alpha reductase inhibitors like finasteride or dutasteride, mainly because I'm dealing with the normal population. And I've seen them really fuck guys up because, if you just take a guy who has normal levels of androgens and then you just knock down their body's most potent androgen, I don't know. I see it having a lot of bad effects. But again, I think I have a sample bias there because no one's coming to me being like, hey, I'm on finasteride and I feel great. I just want to tell you about it.
Right.
A lot, like if you look at the literature, only around 2% of people actually experience side effects. My bias says it's probably higher. But I don't know. But I do think that DHT has a huge benefit, obviously, in bodybuilding, mainly from like the strength and aggression standpoint.
Right.
Though I would think that you should still be feeling it because those drugs like Primo or Masteron or DHT derivatives, they don't actually 5-alpha reduce. So there shouldn't be any impact on it from the 5-alpha reductase inhibitor.
That's exactly what I was thinking. And that's the reason why I feel comfortable taking finasteride, is because I know that I will be jumping on DHTs here and there anyways, having a full big ass excess of DHT, right?
Right.
But the thought that had me is like, for example, I haven't been gaining very much strength, but like a pushback to that is I actually recently talked about this on a couple other podcasts. I got my raw data from 23andMe, and then I input that into Prometheus with a friend and got basically a long list of my genetic predispositions. And it was super interesting and eye-opening because some of these things I kind of already felt or noticed that might be a difference in me compared to other people. And then it literally laid it out for me and said it was true.
Yeah.
So one of them, for example, was impaired muscle performance. So I respond better to type 1 fibers, which is longer time under tension, more reps, makes a lot more sense. But the sad part about that is with impaired muscle performance, I don't have the power that other people do that are gifted with that genetic.
Yeah.
So I think I've noticed like it's been hard for me now to determine whether or not my lack in strength is because of any side effects or if it's also because I'm just not genetically prone to being a power lifter or a strong guy, honestly.
Yeah, and you're in a physique sport anyways. Who cares? As long as you look like you're strong, it's all that matters, right?
Yeah, but when you're going to like zoo culture and there's like people like Brad lifting.
Yeah, but fuck it. I mean, still, you still look awesome, right?
Thanks,
like
bro.
that's the only thing that matters in your sport. So
yeah, I guess so.
Yeah.
I guess so.
Like usually people just have to lift heavy to keep progressing. But if you can keep progressing without having to lift heavy, I mean, Jay Cutler never was repping that impressive weight. I mean, sometimes he was, but you compare like Jay to Ronnie. Ronnie was doing crazy shit in the gym. And
Ronnie was doing crazy shit.
Jay would be like, doing 70s, 80s with just like, perfect form.
Yeah. I doubt Ronnie and Larry Wheels have impaired muscle performance.
Oh yeah, I doubt.
Doesn't seem like it.
No.
Okay, cool. If you feel like any of the medications that we spoke about today may benefit you, such as BPC 157, GH secretagogues such as Tesamorelin, IGF-1, oxandrolone troche, semaglutide, then you can obtain these from Transcend HRT, and the link for that will be in the bio. If you feel like you're experiencing symptoms of low testosterone, such as depression, anxiety, lack of motivation, as well as lack of sex drive, then you can get this checked out as well by getting your blood work done at Transcend, and they will provide you expert medical analysis. Transcend HRT has worked with many professional bodybuilders and pro athletes, such as Thor Bjornsson, Phil Heath, and Jeremy Buendia. And if you feel like this podcast has any relevancy to you, I do believe that this clinic will provide of great benefit to you as well. So when should somebody, when would be a good time, or when should somebody supplement with, say, DHEA and pregnenolone or any like precursor hormones like that?
Yeah, that's a good question for sure. It's tough. I mean, they should supplement when they have a deficiency, but finding a deficiency is a tough thing to do. DHEA is pretty easy to test and get a pretty accurate representation of. Pregnenolone, I've had a really hard time finding a good lab to do. I kind of like to go off progesterone and pregnenolone both, because pregnenolone rapidly metabolizes into progesterone. So if you have low progesterone, you probably have low pregnenolone. But what I see often, like the test is just so unreliable. If you go through like LabCorp's pregnenolone, I've seen their progesterones get way higher supplemented and their pregnenolone's like going down. Happened to me. Like I was taking 50 milligrams of pregnenolone, which is relatively high for a guy, and my pregnenolone was going down, but my progesterone was going up. So I knew it was probably a benefit. But that's a tough thing to do. You need to really work with somebody who understands what the symptoms are. In like pregnenolone deficiency, for example, when I talked about or alluded to earlier, the verbal acuity decline, like not being able to articulate the words that are on the tip of your tongue. That is something I see a lot of times in pregnenolone deficiency. Insomnia can be another one, or feeling kind of like tired and wired, like that feeling where you feel stressed out, but you also have very low energy, and kind of like drinking too much caffeine.
Do you ever feel like you have that on higher DHTs as well? Like too much DHT?
Sure. And it could have a negative, those could be having a lowering effect on pregnenolone. There's no literature to back that up. There's very little literature on pregnenolone in general, so very little in performance-enhancing athletes. But if you talk to all the people who look at a lot of labs and measure these neurosteroids like DHE or pregnenolone, you often see that guys who run gear have lower levels. And I know I did. When I said that I was feeling stupid when I tested my neurosteroids, they were both bottomed out. They were undetectable. And adding those in was night and day. I felt better sleep. My mood was better. My cognition was better. So I'm a huge fan of those if needed. Conversely, though, if people just add them in without testing and ensuring that they have a deficiency, they could potentially run into issues. I mean, they could get estrogenic side effects. They could get acne. Some people get weird body odor. So there's a lot of downsides to taking them if not needed.
Okay. So how prevalent do you think it is that you see this lowering in, I guess, people on gear versus people just on HRT? Or how much more common?
So gear, much more so. I think on TRT, it's not a guarantee that you're going to run into a deficiency. And a lot of the TRT clinics will tell people that they will, and just right out the gate sell them a DHEA and pregnenolone to go along with their TRT. And the rationale that they use is they look at the chart of hormones from cholesterol down to testosterone, and it goes, cholesterol to pregnenolone to DHEA to testosterone down here. And they say, well, if you're not making your testosterone anymore, then all these other metabolites aren't being made either. But that's just not the case. And, you can stop making testosterone, but still make DHEA and pregnenolone. But I think what probably is driving the deficiency in the guys on higher amounts of gear is like the oxidative stress, because we do see that stress in general, whether it be psychological or physiological stress, can lower the levels, and that's even documented in the literature. So I feel like it's the higher levels of oxidative stress that are probably having a negative impact on those neurosteroids.
Okay, cool. Interesting. So when I was with my coach also back in the day, the one thing I think that he did say that was good was when I accidentally started taking, it's so embarrassing to say I accidentally started, but most people understand the story of how basically like I started taking AIs and pills from him because I was losing nationals constantly, like 16 plus place, and I was getting depressed, and like all I wanted was my pro card. So it was like honestly the most defeating feeling I've ever felt at the time. And he suggested like, yo, this is an aromatase inhibitor. Just take this for the next competition and it'll help dry you out. And I'm like, okay, so it's not a steroid? He's like, no, it's an AI. So I'm like, okay, well, if it's not a steroid, then I guess I'll try it. Tried it. got a little bit drier. Obviously something kind of totally stupid that like a natural should be taking just to lower his estrogen so he becomes more dry on stage. Like,
I feel like they all do though, to be honest. Like I've talked to a lot of natural guys and they'll be like, oh, it's just an AI. You know, a lot of people do that.
Oh, really?
Yeah, for sure.
Oh, damn. This is crazy.
Yeah.
This is mind opening.
I know. Yeah, no, for sure. I've heard a lot of guys.
I'm not the only one.
I'm like, dude, you're not fucking natty anymore. They're like, oh, it's cool. I can do this. And they have a justification for it. But they're like, oh, it just gets me drier and my division doesn't test for it.
Jesus.
Yeah.
Well, anyways, I did a competition with that, and I think the second one, I think I took more stuff, and at one point, one of the pills was Halotestin. Nice. So super strong AI, and because of that, you know, being on PEDs and steroids, I ended up realizing that like it was kind of too late, and I really kind of wanted this anyways.
Yeah,
like I wasn't going to commit to steroids, and I also had the biggest fear of needles, but this kind of like just broke the decision for me. Like it made the decision for itself.
Right.
So,
well, after talking to TN Clark and seeing Vigor Steve, do you still feel that way? Both of them are promoting the Halotestin only cycles.
Wait, is Steve promoting the Halotestin?
I don't know if
only?
he's promoting, but he did just do a recent deep dive into it.
What did he say?
I think he was basically had the same conclusions as TN because I think they looked at the same like literature, which was basically like you could potentially take this without suppression of LH and FSH.
Really?
Yeah.
I mean, from the literature, it seems like it makes sense without the suppression of LH or FSH. But the fact that halotestin is what it is,
I know,
and like there's countless anecdotal evidence of people's emotions being drastically changed on it. I just don't think it's a smart idea for someone to just like run halotestin only. Like if you're gonna do something, just fucking.
I would wholeheartedly agree. When Steve came out with like, I just saw a reel. I haven't watched his video, but I saw that he was talking about Halotestin only, and I was like, I need to do a little bit of a lit review myself. And one of the first things that came up was a guy that they put on Halotestin monotherapy. Mm-hmm. He had the most beautiful tits I've ever seen. It was a Gyno report. It was a case report.
Oh, whoa.
Like it was literally like the best female tits you would ever see. If you just crop that, like guys would be like, oh, she's fucking hot. And then you realize it's a guy. Like it wasn't Gyno like we're talking about, like a little nodule. Mm-hmm. This dude had fully developed breasts, and I just text Steve because we talk often. I'm like, dude, I'm not doing Halotestin only. He's like, yeah, I didn't include this one in the literature because I don't know how I feel about it. I'm like, yeah, me neither. It's just a case study. It's only one report, but it's just wild. Like if you do look up like, you know, Halotestin only literature, that does exist out there. I'm like, I don't know if I want to fuck with that guy now because that's a whole nother level of guy.
What?
Yeah, we should
just
put the picture up in here somewhere.
He's just crazy.
It was like years of Halo for another condition that these doctors were giving him that for. Okay. And then I'm like, why didn't you stop this like 5 years back when this poor kid was developing like a nodule? Because
oh my God.
It looked like a transsexual like conversion.
No way.
Yeah. They were like, the case of Gyno. Usually you see Gyno, you know, a little puffy nipple. Okay. I'm like, this isn't fucking Gyno. Poor guy got implants. That's insane.
Oh man. Yeah.
But
you guys want to start Halo only?
Yeah, I know exactly. That's what I said to see him. Like, I'm not fucking with Halo only.
Anyways, I mean, you know, things can always change. Like, you know, in the future, we might find out that maybe Halo does have some kind of potential somewhere there. But at least where I stand right now, I just don't think it's quite the smartest decision. At least if I was going to make the choice personally myself, I wouldn't.
I'd 100% agree. If I could pick a bioidentical testosterone, even at a higher dose, that, you know, has over a synthetic, I would always pick that. So if you can run like a higher dose testosterone only rather than, you know, 10 other compounds, I don't know. I kind of think that there's probably more utility there. Mm-hmm. So the highest tolerable testosterone dose always, in my opinion. Also,
Steve listens to my podcast and I don't want to make you mad.
Oh no, he won't.
But every time we say Vigorous Steve, he'll take a shot.
Oh, hell yeah. No, Steve would love it.
I don't want to put him on the spot. I also had a little quick discussion with Derek on it. And honestly, the only thing he gave me was like, he really does love tie-in in all his work, but unfortunately in this case, he just doesn't really agree.
Yeah, I don't either. Yeah.
What was I going to say? What are your thoughts on Steve and tie-in's discussion of long versus short cycles?
I didn't really watch the whole thing, to be honest, so I don't know. What was their conclusion?
Well, Steve is a proponent of long cycles. Right. Tie-in's a proponent of short cycles. And this is kind of just like a discussion that's been in the industry for a long time, honestly. Right. And I literally don't know. Yeah. Like, this is one place where I literally have zero opinion. I just feel like a lot of professionals, Jay Cutler included, have had some significant periods of time where they would actually just come off of things completely. Maybe they stay on TRT, but just come off of things completely and essentially, I guess, quote unquote, reset their system. And it seemed to be very, very beneficial. I don't know why. I don't know if maybe it just helps reduce the oxidative stress in their system or something or what, but it seems to like be stimulating with their dose. Cause like after a certain point, it seems like it's hard for you to tell whether or not the dose is still working after so much time.
Yeah. One thing that I would say is if it has anything to do with like sensitizing the androgen receptors or something, I would say that I'm pretty positive. Like I would say with a certain degree of certainty there that the androgen receptors do not desensitize in exposure to other androgens. Mm-hmm. So the more androgens we have, usually the more androgen receptors we have in response to that. So we're not having like androgen receptor resistance because of high levels. Now that used to be a thought, and then they would be like, come off the gear or let them reset. And I think we know pretty well that that doesn't occur. So I wouldn't come off for that reason. I would also say that a lot of times when they would come off, they probably weren't even actually off because they didn't fully understand half-lives of things, like some of their drugs would still be in their system up until they got back on. And this whole time they'd be like, oh, I've been completely off. But it's like, dude, if you looked at the half-life of that EQ you were taking, like you were never actually off. You know what I mean? So I don't know. When it comes to like shorter versus longer, I would say, if you're not realizing the gains that you need to in that short window, a longer window would make sense. But there are those hyper responders who may be able to like, hit their target tissue that they needed to accrue, and then they could wean off and go on to like a cruise. So I'd say it'd be individual dependent. And yeah, the less time that you can expose yourself to the oxidative stress, etc. Sure. But this is professional bodybuilding we're talking about. Some people need to hit a certain level, and you may not hit it in 4 weeks. You may need to do 16,
Yeah. So what's the difference then between like quote unquote desensitizing of the androgen receptor versus just building drug tolerance?
Yeah, I don't know. I don't think we have good literature on that. And actually, the other day I was on Simon Hill's podcast. We were talking about insulin resistance, and then he brought up, and I was like, I've never thought about this. Like, could the same lifestyle factors, and this is Gen Pop I'm talking about, like obesity and overconsumption of food, lead to androgen receptor insensitivity, like estrogen or like insulin insensitivity or resistance? Mm-hmm. And maybe, so I don't know if, maybe you're getting intolerance. Maybe our receptors are, I think there's only really one paper on it. So I'm kind of going back too. I'm kind of backstrapping and maybe being a little, there's a lot of this stuff that we don't fully know. And I think individual response is the most important. So if you feel like my gains, I'm not making any more gains, and if I know that in the past I've stopped at this point, dialed back my dose, and then went back on and I had better gains, then do it if that works for you. If you're still gaining though, I would say keep gaining.
What are the protocols for someone, say like a burn victim, being prescribed something like Anavar?
Yeah, that it's usually a much lower amount. Well, sometimes it can go up to like the standard 50, but like when you're usually seeing it prescribed, it's like 12.5 to 25 milligrams a day. Alongside of potentially like testosterone. Sometimes it's not though. Sometimes, because a lot of the times they don't really, like bodybuilders know endocrinology better than some of the leading endocrinologists because they're not dealing with these anabolic steroids,
Yeah.
But it would usually be like 25 milligrams a day. And sometimes it is just Anavar only, which is crazy.
Is this like year round?
It can be pretty long. Yeah. It would be until, the wounds have healed, which those can be very long healing wounds.
Okay. Gotcha. That's why I'm always lost in thought about this, because I'm like, if these guys are taking this for like a year long or longer or however long they need to, and it continues to work for them, but at the same time, it's like you take something like 50 milligrams of Anavar for like, I don't know, like 20 weeks, but then like you only feel the pump for like the first 8 or something.
Yeah. Sometimes like, I don't know if it's like placebo
that are being lost.
Yeah. I don't know if it's placebo or not. Like, I don't know. Like, because when you first start a cycle, I feel like even the placebo, like you're really into it. Like you are doing everything right. You're like, oh, I'm on this cycle now. So my diet's perfect. My training's perfect. 8 weeks in, you start losing the hype, and it's like not as cool. And you may be not pushing yourself as hard in the gym anymore. You may not be really dialed in on your meals. So it would be hard. Like there's no randomized controlled trial that exists where every variable stays the same past 8 weeks. And we would need that. I would say it's probably a little bit due to the individual losing the excitement of the cycle.
Gotcha. I'm just sharing this just for the sake of sharing, but I had a podcast with Do you know a Ziegler Monster, David Ziegler? Okay, he's got a cool TikTok though. I really like it because he posted this one TikTok about like heart health and bodybuilders, and it was like a really good one. It was like 4 minutes, but he was like fucking extremely empathetic and connected to the audience and saying word by word, just like, as you slowly consume more of this and plaque starts building up in your veins, and then he just discusses like how scary it is that like you have no side effects, but then maybe you have a side effect. I don't remember how long he said, like an hour before or something, you actually have the heart attack. So it's really a silent killer that we don't really realize. But this guy, when he was on the podcast, he explained that he used to do really long cycles. And finally, at one point, after talking to like Jay Cutler and some other professionals and stuff, he decided like, for some reason, he just hit a huge plateau. And what he noticed was he would do like a gram of total gear, and that would work great for him. And then he decided, what do I want to do to step up the game and get to the next step? I'm going to go to 2 grams. I'm going to exceed 1.5 to 2 grams. So he jumped from 1 to this bigger dose, and then he did it for like a full year. And he said that for some reason, he plateaued and he didn't make like any new gains whatsoever that year. And he was running like almost double what he was running before, and he couldn't understand it. So after he finally like tried to realize, like figure out why he was hitting this plateau, talking to these people, I guess looking at other pro bodybuilders like Jay Cutler, he pulled back on it and decided to drop everything significantly for a long period of time. So he was just running, I think he was just cruising, maybe just on TRT for a long period of time. And he said during that period of time, he didn't lose anything. Obviously, he wasn't gaining, but he didn't lose any of his gains that he made. And his physique still looked really great. And then finally, he jumped back on and he decided instead of going back to the 1.5 or 2, he's going to stick to the 1 gram that he was comfortable with, that he was making so many good gains on. And his fucking plateau broke. He fucking blew back up again and gained a lot more size. And that's when he started just doing shorter cycles. And he said ever since then, it's been beneficial for him. So that's a huge curiosity to me. I understand too, like we all know, like with the literature and in this bodybuilding space, there's so many different things that work for so many different people. Yeah,
I would say the literature is like minute. You know, you kind of have to. We can't devalue like the massive impact that anecdote has, like that. You know, because we're not really researching the bodybuilders. You know, like I said, there's probably one study on androgen sensitivity and the receptors. Like, why do researchers need to waste money and time to research that? You know, it's not like there's 15 papers out there that we can do a nice lit review on and do a meta-analysis on how the gear impacts androgen receptors. It just doesn't exist. We can't even do a randomized control trial because it's unethical, you know, so you have to listen to bodybuilders. And most of the time they know what they're talking. Like, I get so pissed with the evidence-based community when they're like, oh no, the literature says this. And you're like, look at that fucking guy. He's massive. You know, he obviously knows what the fuck he's doing. You know, the literature told you that, you know, this person grew a millimeter more muscle than the other person when you did this. Well, like, look at Jay Cutler. The dude's a fucking animal. No one can build more muscle than that. We should probably listen to him, even if it sounds like bro science or pseudoscience. You know what I mean?
Right.
And then usually a decade later, we get some literature and we're like, oh, you know what? The bodybuilders have always been right. We can actually eat more protein than we ever said that you needed. I know we've been saying that you only need this much, but the bodybuilders have been saying, no, eat a shit ton. They're right, you know? Yeah. So, yeah, I mean, I would say, like, when it comes to this space, this really gray area of science, like, anecdote is probably more important than literature a lot of times, because the literature is not done in our target demographic. So listening to that guy, to Derek, to Steve, to you, people who have actually experienced it and been in the trenches, kind of has more weight than the scientific literature.
Nice.
I think. Cool. I mean, it's not like, I'm not saying that in general, but in this space, because we just don't have the literature on it, you know? I wish we had a bodybuilding journal that all they did was randomized control trials on bodybuilders, but we just don't, unfortunately.
Yeah. I kind of feel the same way, honestly. But the thing that I was getting at before about how my coach, you know, I kind of just took those AIs and then I took the pill and the oral and stuff. I did confront him after I started taking the Halotestin, and I was like, what do you think about SARMs? Yeah. You know, because I was too scared to inject shit. So I was like, what do you think about SARMs? And he's like, just do the fucking real stuff.
Yeah, like, 100%.
What do you think about SARMs? And also, I want to ask GH secretagogues.
Yeah, I don't like SARMs at all. I think that they were, if we could make a good one, they would be awesome, right? So SARMs should work in that they only work on the androgen receptor in selective forms, nowhere else. So the benefit to them would be, say you've got grandma who's dealing with cachexia, which is like withering away of her body. She needs to grow muscle, but she doesn't need the androgenic effects of, say testosterone or DHT and things like that. She doesn't need to grow a beard. She doesn't need those androgen, like all she needs is the anabolic effect of the muscle hypertrophy. That would be awesome. The problem with it that I did a really deep dive on this on my YouTube channel recently, and I was like, how would these work? Because we only have one androgen receptor. We have multiple types of estrogen receptors, which makes sense that we can have a selective estrogen receptor modulator because there's multiple ones. So you can make it for like ER beta, and then it will have a much larger affinity to an estrogen receptor in the hypothalamus or pituitary. We only have one type of androgen receptor. So how do you make a selective one? Their hope is that maybe it won't be 5-alpha reduced in other areas. And, but that's a stretch in my opinion. And they base that all off of, when we give guys testosterone with a 5-AR, they don't get as large of prostate growth. So their thought is, if it's not exposed to the 5-alpha reductase inhibitor around the prostate, it's not going to have that effect. But we just see, like, I've seen so many guys come in with major suppression on SARM. So if they were actually only working in the muscle and only working on the androgen receptors in the muscle, they wouldn't be stimulating the hypothalamus and pituitary, and they wouldn't be, driving the suppression, but they do drive the suppression. So I don't like them in any way because you're going to make more gains on, anabolic steroids that have been tested in humans for decades, and you're going to have less side effects. They're also massively liver toxic, and we don't even know the full ramifications of them. So I would say just pin some shit.
Just pin some shit.
Yeah. Definitely. Yeah.
What did you say on another podcast about something along the lines of like the clients that came to you doing SARMs had like more suppression for a longer time?
Yeah, they absolutely do. It's crazy because I'll see a guy who did like, a full-blown steroid cycle or 2 or 3 or 5 in their day, and then they recover just fine and they come back with good levels. I've seen a guy who will do like 1 cycle of SARMs and they're just fucked. Like they have significant long-term suppression for a very long time. Some of them have non-alcoholic fatty liver disease, SARM fatty liver disease, because their GGT is super high, their ALT, AST is super high for long periods of time. They're extremely liver toxic. So I just wouldn't mess with them. And I've taken them in the past. Like when I was at least on a testosterone like base, but I was like, I'll try these things out. They didn't do anything for me, but my liver enzymes were fucked and I was seeing yellow. I forget which one that is. Do you know what I'm talking about?
You were seeing yellow?
Yeah. I forget which one it is now. SR4 maybe. Okay. Like literally just everything turns like bright yellow, like everything. It looks like you have a filter on and you just crank up the yellow tone.
That's crazy.
It sucks.
Oh man, that sounds bugged.
It's wild. And this is when I was like in school and I was like in a surgery and they would like shine the light down and I'd be like, fuck, everything's yellow. And they're like, hold the retractor. And I'm like, I can't fucking tell the difference between like the flesh or not. Everything's just yellow.
Damn.
And, yeah, it's stupid.
Yeah, I wish I knew more about those stuff, but I did no research on SARMs, honestly, ever.
Yeah, no one should.
I just wasn't interested.
Yeah, I love how like Vigorous Steve says like, I'm a real athlete. Like I don't mess with SARMs, and I think that's 100% true. Like we don't even need to know about them. We don't even need to talk about them because they fucking suck. One day, if we make a good one, cool, they'll be the coolest thing ever. But we're not there yet.
He loves the dog on the SARM goblin.
Yeah, the SARM goblins are idiots.
SARM goblin broccoli heads.
Exactly.
What about the GH secretagogues? Because I guess the only thing that I took that isn't even a SARM, but they considered a SARM was MK, right?
Yeah.
So what are your thoughts on GH secretagogues like MK?
Yeah. So just to differentiate, they are 2 completely different things. Since they all get sold by research chemical companies, everybody just kind of considers them as the same. Like so many people think MK677 is a SARM and it's not. So we're talking about selective androgen receptor modulators and then GH growth hormone receptor or secretagogues stimulate the release of growth hormone. And those are beneficial, good. They actually have a good amount of literature backing them like Tesamorelin, Ipamorelin, MK677, they're all great. So they definitely do work. I also think a lot of people waste a lot of money on them. Like your standard guy going to like a TRT clinic gets put on a low dose. And, I think growth hormone is wildly overrated personally, like actual growth hormone. I don't know. What have you ran growth hormone?
I did experiment of growth hormone. I did 3 IUs every 5 days a week, which was 2 IUs every day on average.
Did you like it?
I didn't feel too much of a difference, but I can tell you in the long period of time that I did both Tesamorelin and growth hormone.
Oh yeah.
I do want to say there could be a potential of it also being from the compounds I was taking, but I was taking compounds before this as well. Mm-hmm. I stayed very lean, and honestly, to this day, looking at myself in the mirror, only having like 3-4 weeks of bulking left, I'm thinking in my head like, fuck, I could have eaten more calories. I should have told my coach, because I still see my abs. And so I can't tell if that's because of the GH or maybe what.
Yeah, that's what I said too. Like I said earlier, like I ran a lot of growth hormone for a period. Mm-hmm. And looking back, I'm like, I think maybe I was leaner during a bulk, which was cool. That's a win. I would say that's a win for sure. But if you're taking your standard guy who's hoping to just, completely transform his physique using the GHRP, likely not going to happen, and you're likely not going to get much out of it. I would say I would run a normal, like higher than probably like 3-4 plus, way higher if you're a bodybuilder.
Way higher.
Potentially, if you got the money for it, right? Okay. I mean, you familiar with like Chase Irons?
Yeah.
Yeah, like he was running ridiculous amounts and literally like transforming.
Was he really?
Yeah,
How
dude.
much?
I forget. It was like 20 IUs or something.
Jesus Christ.
Yeah.
What about his gut? Did you see like a huge...
It actually looked pretty decent.
Really?
Yeah.
Like it stayed tight?
Yeah.
Was he doing insulin with it?
I think so. Yeah, he was pretty transparent with all of it, and like 3 grams of gear.
Was he doing... Oh my God.
Yeah.
Was he doing... Oh my God.
He actually looked like a fucking monster though, because I saw him in person. I'm like, holy shit. Like he actually transformed.
Really?
He was like visibly just morphing on the camera.
Was he doing a fuck ton of food too? Or
yeah, probably.
Because
sure.
I want to know how the fuck his gut didn't grow.
But then he had...
he was doing tons of food too.
He had Roman Fitz, that guy, I think Roman Fitz, that was his last name. Roman, the German bodybuilder. Do you know what I'm talking about?
I don't think so.
He's a IFBB pro. Okay. He's on Fuad's podcast occasionally. Funny ass.
Chase does look fucking big though now.
Yeah, dude. Chase is fucking huge.
God, Jesus Christ. He looks pretty open.
And I think right now he is recovering from knee surgeries, like bilateral, and hasn't been lifting anywhere near what he was in his peak. It says he was really fucking large.
Damn.
But he had Roman on, and Roman was saying like most guys in the IFBB, like top level, are doing like 16 plus IUs. He was like, they're just lying about it. We all do that much, which is interesting.
Why the fuck am I doing 2 IUs on average?
So, yeah, I don't like the cycles like 1 and 2.
Any size.
Yeah, I don't think you gain much. I don't know, but they swear by those really high doses.
Okay.
But I
did notice my hair growing faster though, so that was nice. Yeah, my beard growth was quicker. Like the testosterone, the increase in testosterone, because I've never ran anywhere close to 500 milligrams of test before.
Oh really?
And now that I have, like my hair and my fucking face started coming out.
Nice.
And then
I see it.
When I added in the Tesamorelin, the GH separate times, the hair both on my head and my face grew faster too.
Yeah.
I started growing like a little bit of hair on my abs and stuff where I've never had that before, which I didn't like, but whatever. Well, so it's kind of.
Yeah, I would say so for like, for like a bodybuilder, I would say just run higher dose growth hormone, real stuff. If you're just a normal guy, where I think they have the most utility is probably in recovery. So when people are like, just feeling beat up and they're not recovering from their training, that can be really beneficial. It can also help to improve your sleep. So if you need to kind of like reset your circadian rhythm and you're having a really hard time sleeping, that can be really beneficial too.
You knew Dr. Charlie Winegrove, right? Or at least love him. Yeah. So I had him on, I think right before you, and it was really cool because like I didn't expect him to talk about this stuff with me, but he decided to talk about steroids and growth hormone with me. So, which is cool because this guy's like, he definitely sounds like a genius.
Yeah, he's awesome.
But he was mentioning that, like, for example, like in a lot of sports, especially something like football, like the PED that you would probably most reliably expect someone to take is going to be growth hormone.
Yeah, absolutely.
One, obviously, because it doesn't contribute greatly to size unless you are literally tactically inducing yourself with hypertrophy.
Inducing training.
Inducing training, right. And then also eating all the food.
Yeah.
So it's not very noticeable physically. And it literally contributes in every other way that you would want to as like a sport athlete.
Yeah, when I did CrossFit for a while, and I definitely assumed most of those people had to have been running growth hormone. If I had to design a cycle for a CrossFitter, growth hormone would absolutely be in it just because of the sheer volume of training that they do. How else would they recover, So I think that it's great if you need recovery if you're an athlete for sure.
Okay. So I guess maybe that's where it can really contribute a lot to like your gains in a bulk, say like.
Yeah, really you can hit your
go harder and harder and harder.
Exactly. Yeah, but I do think it has some, fat reducing effect, like you said. Because I mean, we both experienced the same thing. Like if we could pick out anything, it would be we were leaner on the same amount of calories, which is huge. Again, that's a massive thing. And incremental benefits like that are usually what you're getting. But I think the lay people kind of think that's like, oh, I'm going to add this one thing in and it's going to be mind blowing where everything's going to change. But usually it's like an incremental benefit. Like, oh, I'm a little bit leaner this time, you know? And that's huge to a bodybuilder, but not to your average person. Yeah.
Yeah. It is kind of really nice to fucking see that I still have abs at the end of the bulk, but
hell yeah.
The concern that I haven't been eating enough is still there. You want to jump to the Q&A real quick?
Sure. Yeah.
I was going to say, I did kind of, I want to look for something real quick because I had a thought where I was thinking like, I wonder if it would be fun if I decided to just expose myself and show you my last blood work and see what you thought.
All right.
What is the difference exactly between, and the difference in importance too, between getting your ApoB versus like your LDL? No, not your LDL. LP little a.
Well, they're two completely different things.
Right.
Yeah. So LP little a, you only need to really do one time only in your whole life because you either have it or you don't.
Okay.
So you have the gene that codes for that protein or you don't. So if you have elevated LP little a, you're going to be at an increased inherent risk of cardiovascular disease. But if you get it and it's 0, you don't need to keep wasting your money repeatedly ordering it. And conversely, if you get it and you have it high, you just know, shit, I've got it high, and you know that, and that's an increased risk. So ApoB, on the other hand, is going to be impacted by things like your diet and supplements and medications. To this date, we don't really have anything that lowers LP little a. I mean, we do have the PCSK9 inhibitors, but we don't know if that is clinically significant. So they may lower it, but it doesn't change your risk of heart disease. So yeah, difference is, or only do the LP little a once.
Gotcha. Yeah. Okay, that's what I thought. I've been doing my ApoB pretty regularly as well. Yeah. So before I started taking the Zetamib, though, it was really fucking high, which was embarrassing. I asked Derek his input on it because it was like, I think it was like 130 or something crazy high, and he was like, dude, you need to bring that down.
Yeah, it's pretty high.
Okay. So this is my lab work from, I think it was in December, the end of December. So it's been about like three-ish months since then. But just out of curiosity.
Sure. Oh, you want me to look at it? Yeah. All right. So you had a little bit of elevated red blood cell count and hematocrit. So that's the percentage of red blood cells in your blood. I don't think that's problematic. It's actually pretty low for a guy running a significant. Were you on a significant cycle at this point?
This is the biggest cycle I've been running, but it's not really, relative to other people, it's not really big.
So I would say it's not problematic. There's a lot of debate on this in the TRT community, and I don't think a slight erythrocytosis or an elevated red blood cell count is problematic unless it's a sign of something like sleep apnea, for example, or if it gets too high. But a 53 that it's at now is not bad. That would be the only kind of notable thing in the CBC. And then your CMP, the comprehensive metabolic panel, your fasting glucose looks great, and it's been 85 consistently. So you're probably, very insulin sensitive. I would like you to get a fasted insulin next time. That'd be cool. Your creatinine.
Yeah, because you were saying that you prefer fasted insulin over fasted glucose, right?
100%. Yeah,
okay. Because I do get my fasted glucose every morning. It tends to teeter on the higher side, and also in my genetic predispositions, it said I tend to have a higher fasted blood glucose than most, sitting at around 93. Where I see it, it does actually sit around 93, and sometimes it'll go close to 100. Well, but this is even when I'm on GH.
85 on here, so it's good. Your EGFR, so your estimated glomerular filtration rate, hate that word, based on your creatinine here is actually really good. So you've had a 92 and 90. We almost never see that in an athletic person in general. Because the creatinine elevates from supplementing with creatine, from breaking down muscle to consuming red meat with creatine in there. So your EGFR is awesome. So I bet if you got a cystatin C EGFR, it'd be even higher, probably like, above 100. So that's awesome. You'd probably have really good kidney function. So I wouldn't be worried about that.
Oh, wow.
Put
me on that till it's hard.
Yeah, exactly. Your kidney function looks awesome here. And again, we don't really like to use a creatinine in an athlete because it's not a great representation, but that's usually because it's abnormally high. Yep. Yours looks really good. Your liver enzymes were elevated both times. Have you been on orals?
No, I haven't been on orals. My liver enzymes have always been elevated, even if just a tiny bit.
Yeah.
I used to have my liver enzymes anywhere from, when it was at its worst, was between 200 to 300.
Oh, shit.
And I was I was getting a liver biopsy. They were concerned that I had hemochromatosis. This was years ago though, and after that, completely came off. Didn't take orals anymore, like at all, and started taking other ancillaries, astragalus, glutathione, and it significantly improved it. The reason why I have that, I'm not really sure.
Well, this is mild based on what you said you had previously. Some people just do have this idiopathic. That's a fancy way of saying we don't know why. Elevated enzymes, which would be transaminitis. And I've seen that before. A lot of guys come in, they're like, I've had liver biopsies, everything's clear, and they just have this elevated level. I've seen it in some professional bodybuilders too, who are like, dude, I'm not, they would tell me because they tell me everything they're taking and they won't be taking something. And I hypothesize it's likely due to the sheer amount of muscle that they have. Because some of these, like the AST is produced also by muscle tissue and heart tissue. And sometimes when guys are just so big, their enzymes are going to be a little bit higher because they have these cells that are producing these enzymes. So it could just be from being massive. It also could be from working out before labs. So do you take some days off?
I do take at least one day off before my lab. I know I should take like 4.
Yeah, I would probably try to push like 3 to 4. So for those listening too,
it's
like
so hard.
It's super hard to do. Just do like light cardio on the days leading up. So if you are getting a falsely elevated liver enzymes due to that, we could see if that was the case. But it sounds like in yours, you just have these weird elevated ones. Then next is your lipid profile. Triglycerides look great. HDL is actually really decent. LDL is 94. I would personally like that to be a little bit lower. I like mine like 70 and below. I think mine is probably like 30 right now. Wow. So I would like it to be like as low as possible. I'm on the side of like extreme caution and preventative. In general, yours look good, especially for being on like elevated inducing drugs kind of, yours look really good, but you look super metabolically healthy given where your triglycerides are and your glucose are. I would just add in like a fasting insulin, probably an A1C, and then just do a cystatin C in the future, maybe a GGT too. Have you ever done that?
I feel like I have, but it's
for liver. I'm sure if they were doing like a thorough liver workup, they probably did. But that's just another good one to see. It wouldn't really tell us much more, but it would be interesting to see where yours is at. But overall, I think your health looks great as far as this is concerned.
Did you see the ApoB?
Oh, I didn't. Where was that at?
Oh, I think
next page?
Yeah, I think just the next page. Yeah, like you just...
Oh, you got a whole bunch more.
Yeah, there's a few pages.
Never mind, we're not done yet. Let's see. So LH and FSH are suppressed. He's not natty. Oh, you got a you got a CAPS testosterone. This is one thing I would point out to you. I would always go for the LCMS testosterone. Do you know the difference?
Yeah.
Yeah. So he got like a capped one. So it basically just tells us it's above 1500. And this actually is not accurate in any way. Derek actually did a good video a while back when he did an androgen only cycle and his testosterone was coming back elevated. He's like, I'm not taking testosterone, but he got this ELISA one. Yeah. And it was like, it was registering as that. So I saw a guy recently and I thought he was lying to me. I'm like, this dude's fucking lying because this shit kept coming back 1500 and above. And he's like, I'm taking only 100 milligrams of testosterone. I don't know what's wrong, but he was also taking nandrolone. So the lab was reading it as a combined. And I don't know if like taking DHEA or something like that could also contribute into that pool of what they're reading. So just for people listening, LCMS, the liquid chromatography mass spectrometry is the definitely the best.
I have a hard time saying that every time.
Yeah, it's tough science words. A1C that was 5.5, so that's good. Where's your ApoB at? It's on here. Oh, there's all these pages. Okay. ApoB is 91, so that is a little elevated. It went up from your 84 before. And ApoB, oh, you got a GGT on here too. You got everything I asked for. ApoB of 91 is a bit high. There's thought that like 60 and below was really preventative, so that's what I would target.
Right.
So yeah, I would try to get that a bit lower.
How would you recommend getting that lower aside from cardio?
So cardio probably won't have any impact on it, really.
Oh, really?
Yeah, cardio doesn't have much of an impact on the LDL-C or the ApoB. It's more on like the HDL-C or the apolipoprotein A1. But through increasing HDL, theoretically, through reverse transport of cholesterol, you could lower ApoB. So in that way, it indirectly could. But really, like the next thing you'd probably have to do is add something like a statin or bempedoic acid to lower it even further.
Whoa.
I take a statin. Man. It's not terrible. It's great.
It's not terrible. You've never had any issues like getting muscle pains or anything like that?
No. I mean, I've literally like lowered mine to almost 0.
Okay. All right.
I mean, I'm not saying that you have to, but
yeah. I was just hoping ezetimibe would be enough for me, but
it's not a very strong drug.
Probably not. Yeah.
Yeah. And it just, I mean, in general, it lowers it by around 16%, which is very minimal. But I take a base of ezetimibe 7 days a week, 10 milligrams. And then I take 5 milligrams of rosuvastatin, which is super small. Like a dose can go up to 40 milligrams. I take 5 milligrams 3 times a week. And that lowers mine to like 30. Like it's insane how effective it is for me, coupled with a low saturated fat diet. And I haven't felt a thing, but it's a really heated topic. We'll probably get all kinds of comments on this shit. People, saying I'm a pharmaceutical shill or something. But I like it.
I've had a lot of professionals and like really top bodybuilders basically say like, why would you not take a drug that's literally got less side effects and going to help you with your longevity if you're going to take fucking steroids at all?
100%.
Dr. Mike said that on the last podcast. So.
Yeah, I couldn't agree more. Let's see, your IGF-1 on here was high. Makes sense because you're on the GHRP and testosterone. Your TSH was a little high here. Did you see that? You were at 3.5. So I usually like a TSH, thyroid stimulating hormone, below like 2.5. Don't really know why yours was higher. Hard to say because historically it's been fine, which also just illustrates the benefit of getting repeated labs and not just seeing one lab only and making like, oh, I need to throw in thyroid hormone. Like if your clinic's not measuring multiple labs to make sure that like you actually need something, I would go elsewhere. Let's see, was there anything else in here I missed? Your actual T3 looks great. So that's another really good point is if you were just measuring TSH, you'd be like, oh, that's high. But, we wouldn't start somebody on TRT just because their LH is high, but they have 1,000 testosterone. That's what you have here with this high T3 of 4.3 with a little elevated TSH. Do
you think, reeling back, have you heard of any issues that anyone has had taking, say, for example, telmisartan and a statin together? No.
I've taken them together.
Okay.
Yeah. Never had any interaction.
Okay.
No.
Cool.
Should be good.
All right.
I think that's all on here.
Cool.
Let's see. Oh, you got your DHA. Do you have awesome DHA? Do you supplement with it?
No, I don't.
Oh yeah. See, prime example. Like to think that it has some, mechanistically, since you aren't producing testosterone, you're going to have lower DHEA. Like you have beautiful levels of DHEA. His is
that's just a nice word, beautiful.
Yeah, just for those listening, it's 418, which is pretty damn high. Mine was like 10 when I first measured.
Whoa.
Yeah, it was bottomed out. What? So yours is awesome. Yeah, dude, you look dialed in, man.
Cool. Thanks for that. The craziest thing that I learned from my genetic predispositions from my test?
What's that?
It said that I had a lower response to androgens.
Oh, interesting.
So I don't know what that means, but
yeah,
hopefully.
It may have been measuring what are called like CAG repeats or CAG repeats. Have you heard of that? So it's probably the only thing that we really know when we think about how sensitive somebody is to an androgen. And we all talk about like hyper responders versus not, guys who actually respond well. I would have probably thought that you were probably a pretty hyper responder because you grow really well. But we have these what are called CAG or CAG repeats around the receptor. So the more of those you have, the less androgen sensitive you are.
I see.
So there's diseases where people have these really long CAG repeats and they have muscular atrophy. And the shorter ones, like somebody with really small amount of these CAG repeats around their androgen receptor is very sensitive. So
gotcha.
you're probably your standard IFBB, I would guess.
I don't really want to like defend myself and like blow up my ego and everything by saying like whatever, I like work so hard.
Yeah.
But I do have, if I'm just going to be straight up with what my observations are, my whole entire family just looks extremely unathletic, like kind of like the bad guy in Despicable Me, who's got really skinny arms and skinny legs, but then like a big body.
Yeah,
it's what they all look like. And like my dad and like his family are like extended professors and stuff, and the rest are in the Philippines, so everyone's kind of like not really. They don't have the best nutrition as well, and like no one trains or works out, and they just so.
Well, you should defend yourself, though, because, I mean, even like the top dudes who I've seen who do respond well, they're fucking training so much harder than anyone else still.
That's what I'm wondering is, like, now that I'm actually seeing things, like, I've always thought that it was harder for me to gain more mass. Everyone would say, dude, you look amazing. You have great genetics. And I'm like, why don't you guys ever, like, say that someone looks great maybe because they actually, like, work hard to try to do their science?
It's so true, though.
I do have great proportions. I have amazing proportions. That's the cool part. Like, I do have a smaller waist than most people. That's absolutely genetic, and I'm so blessed to have that. But seemingly from the science and the experience, this Asian body isn't quite prep to look like Ronnie Coleman, nor lift the strength of Ronnie Coleman with impaired muscle performance. So
yeah, but you put in the work, and that's what I was saying most people lack. Like the amount of dudes that come in and be like, oh, I can't gain weight. I'm like, how much are you eating? And they don't even know what they're eating. I'm like, you're not fucking eating enough. You don't even know what you're eating. Like you need to be eating to the point of feeling full, and then like waiting an hour, and then eating to the point of feeling full again.
Yes.
And doing that repeat for 5 years every single day, not missing. And then like if you haven't gained weight after 5 years of doing that, and you don't look impressive, like, okay, then you've got an actual issue. Like we can talk about it. Mm-hmm. But nobody gives it that time. They give it a week and they're like, fuck, I don't look good yet. And then they give up. Yeah. So yeah, it is hard work.
Okay, let's jump to like at least one of the questions, and then let's wrap this
one
up.
Lucky dude.
Ali Gilbert asks, how do I increase my load size as a chick? I know you're an expert on super load for men.
Oh yeah, I don't know. As a chick, I think just be more hydrated.
More hydrated.
Yeah. I'm thinking she's thinking about squirt. I think just have to drink more water.
Then she asks, what are your favorite recipes that include semen?
Oh yeah. I don't know. I'm not a semen consumer myself.
Oh shit. Do you have any like recommendations on like just load in general?
Not
aside
really.
from like taking something like HCG.
Yeah. Yeah. HCG, I guess. FSH. Derek's Gorillas Lock and Load. Use my code Atlas.
Nice.
I don't know. I've never taken it. I kind of want to take it, and just see, but like that conversation's weird when you're talking to the people there. Mm-hmm. Like, I don't know how your deal is with, who are you with again? Who is it? Huge?
Transcendent and Huge.
Oh yeah. But when I'm like getting supplements from Gorilla, I just basically tell them what I want, and it would be weird to be like, oh yeah, send me some Lock and Load, because like everybody knows why the fuck you want Lock and Load, For like it's just a weird conversation. So I'm like, I don't know, they want to try it, but I've never tried it. I do have friends who've tried it who liked it. So yeah, Lock and Load.
Did it improve them a lot?
Yeah, they said it's great. I also have a friend now too who was trying to get his wife pregnant. And I think we've got him on enclomiphene, HCG, and FSH. We're just throwing everything at it, and he says his loads are insane.
Okay, yeah, it's gonna work for sure. I know. Well, cool. Logan Bodybuilding asks, "Do statins deserve the hate?"
To who?
Do statins deserve the hate?
Yeah. No, not at all. And I know that guy. He's a cool guy. Yeah, like we said earlier. No, I don't think so. Not at all.
Okay, cool. And then I don't know if you have any knowledge on this, but Mena asks best way to treat meniscus tear in the knee.
That's tough because the meniscus isn't very well vascularized, and that's probably the biggest issue with it. Is it's a hard time to heal. But I would look into the healing peptides like BPC 157, TB 500. The benefit to something like TB 500 is it may increase vascularization, or angiogenesis, or creation of new vessels. So maybe something like that, and then just talk to your orthopedic surgeon and get that thing cleaned up.
Cool. Awesome. Nice, dude. Cool. I ask one question at the end of every podcast.
All right.
So if you were to die tomorrow and you had one message you could send out to the entire world, what would it be?
Dude, that's a good question. That's deep. That's a tough one. I guess it would probably just be, don't give a fuck. Like life, if you're going to die tomorrow, our mortality is evident for sure. And to think about all the times that you gave a fuck what other people thought about, and now tomorrow it's over and they're all going to forget about you. And to be honest, they probably never thought about you in the first place. So quit giving a fuck what other people think about you, and just, do what you want to do. Live the life that you want to live. That's what I say.
Nice. Yeah. Hell yeah. Thanks for coming on, bro.
Of course,
Thank
man.
you. That was awesome.
Hell
awesome. Where can everybody find you?
Trying to grow the YouTube right now, so putting a lot of work into that. So just my name, Dr. Adam Hotchkiss. Instagram, Dr. A.E. Hotchkiss. I'm sure you'll put it up. So yeah, either YouTube or Instagram.
Nice. Awesome.
Cool.
Thanks for watching, guys. If you'd like to support the podcast, you can by rating us a 5-star on Apple Podcasts, Spotify, or anywhere you find a podcast, and subscribing to the YouTube channel and clicking the bell button, because that helps us get bigger, greater, and sick, smart-ass guests like Dr. Adam today. So
hell yeah.
See you guys next time. Love you guys. Peace.
I think that'll be good. Yeah.